Welcome to you all on behalf of UCLA, and thank you for participating in today's conversation. I would like to also thank my colleagues, Neal and Gary and Colleen, for their participation today and contributions over the last 2 years. My job this morning is to introduce the role of a framework, which we're going to propose to you and explain why that's important, and then to focus on the impacts of climate change on human health. So the first thing that we're going to do is suggest how we would go about assessing the impacts of climate change on health, and a framework for providing you with sort of a guideline or a guide for that. A second objective is to summarize the best practices in the climate health pathways, focusing on those that are going to be most relevant to the LA region. And then these first two we're going to focus on in our panel discussion right now. And then that third is really what we hope you will help us accomplish and engage in as we collectively discuss projects and opportunities and synergies that we have between us here in the room today, and think about building a broader initiative and effort moving forward. Why start with a framework? I think one of the reasons that when it comes to climate change and health is the relationships are very complex. And so a framework helps us identify the factors that matter the most and put those factors in a context such that we can begin to understand the relationships between them. And that's really the essential goal of a framework, is to help identify the causal pathways between different factors that go from climate change to health. One of the things that we have appreciated in the academic community is how challenging it is to identify all of those relationships and to map out those effects. And so historically, we started out with very kind of linear descriptions of the relationships. It gets warmer, asthma rates go up. But then as we learned more and we did more research, we began to identify the need for frameworks that weren't so much linear, but that were more complex and had a lot of feedback effects in them. And today, one of the things I want to share with you is a framework that sort of provides us with an opportunity to recognize some of those complexities and use those when we're trying to understand and anticipate the impacts of our projects that we're developing here in the community and in the LA region. This is a framework that was developed originally by Michael Jarrett, who I am happy to say is moving back to UCLA. He's coming from Berkeley, and he'll be joining us in the fall, and his colleagues. And what we have essentially done, just to give you a sense of where we're going, is we've taken this framework and we've added some complexity and we've adapted it to the LA region to identify the most important factors between climate change and health outcomes. And the first circle there is exposure. Exposures result from impacts, the climate impacts that people experience. And these are going to be things like temperature change, changes in precipitation, changes in wildfire incidents, changes in water availability, things like that. So those impacts create exposures to individuals. Then the way that those things affect individuals depends on the individual's sensitivity, their susceptibility, their vulnerability. A lot of different terms for this. And that's often related to a variety of socioeconomic and demographic factors. Are you very young? Are you very old? Are you poor? Are you linguistically isolated? And then the third circle is adaptation. What are your abilities when you are exposed to a climate change negative effect? What are your abilities to adapt? How resilient are you? Well, that may have to do at the smallest scale with your wealth or your education, your ability to link to others in your community and your family. At the community level, it may have a lot to do with your infrastructure system and whether or not you have a robust urban forest set of resources available to you. And when we think about the intersection of exposure, susceptibility, and adaptation, and we think about how those things come together in the LA region, and we really want to focus on, well, what are the health risks to individuals and families and communities going to be? What we want to do is evaluate each of those circles. So I'm going to turn first to exposures, and I'm going to talk about what we expect to happen here in the LA region as a result of climate change over the next 30 to 50 years. And then my colleagues are going to cover some of these other areas of influence, the adaptation, the susceptibility. What I would like to do next is take you through some of the primary climate impacts and some of the secondary climate impacts. And I'll go through these and then come back to them. And then I'm going to turn the mic over to my colleagues to sort of fill in these other circles. So as many of you probably know, climate change is occurring. And if we don't take efforts to mitigate the GHG emissions that are occurring, we can expect the concentration of greenhouse gases to increase from their current levels of about 400 up to 1,200. And what that's going to mean, those things have impacts on the local weather, and I'm going to talk about those in just a minute. If we manage to sort of stabilize the climate, we're likely to still experience in the short run many of these climate impacts because there's a lagged effect. It takes time for the Earth's atmosphere to adjust. And so we need to adapt no matter what, even if we are successful in mitigating emissions. So what I'd like to do next is present to you some work that a colleague of mine, Alex Hall, did at UCLA. And he took a variety of the global climate change models and he translated those models down to what they mean for Los Angeles. The traditional models that they've done are very broad scale. And then what Alex did, he basically zoomed in and did a 2 by 2 kilometer impact analysis of what's going to happen neighborhood by neighborhood to Los Angeles over the next 50 years. And I want to take you through some of those predicted impacts. And this is kind of the synthesis of approximately 18 to 22 models kind of and their average prediction for LA. So the first thing that we expect to happen is that temperatures are going to increase. So throughout my presentation of the impacts, I'm going to compare sort of business as usual with kind of what the current availability of resources or the current conditions are. And so one of the things that you can see as you look from the left side to the right side, the left side is sort of what the temperature in August has been over the last 20 years. You can see to the right it getting redder, and that's what will happen between basically starting 2040 to 2060. So 30 to 50 years from now under the business as usual scenario if we do nothing. So that's what we're going to have to adapt to. Let's sort of look at a higher level of granularity. Essentially what we expect to see is a significant increase in very hot days per year. I'm going to show you some average changes in a little bit, but for many health outcomes and many acute exposures, whether it's air quality or heat exposure to individuals that happen to be obese, the hot days per year are some of the critical events that affect our health. And what you can see, and I think the granularity of Alex's model really reveals, is that these impacts are going to vary spatially. That in the valley and in some of the peripheral areas, we can expect to see really significant increases in the number of hot days per year, while along the coast, fewer. The orange is kind of what we've experienced over the last 20 years, and the red is what we'll be dealing with 30 to 50 years from now under the business as usual scenario, right? So those are additive. And so you can see that LA has different challenges when it comes to extreme heat days, and those challenges are going to vary across our community. Just taking one simple example, Brentwood versus Sun Valley. Sun Valley, a working class community, Brentwood, a higher income community. You can see an increase there in the average temperature. And while we expect our winters and our springs to get slightly warmer, what we really think will happen is the fall and the summer is going to become much more variable. And we'll see bigger heat increases really and a lot more hot days in the fall and in the summer. Snowfall. Snowfall is important because it provides us with water. The skiers accept it. We care about snowfall because it determines the availability of water and the price of water to our communities. And the headline here is we can expect to see a reduction of at least 40% in the snowpack over the next 30 to 50 years. If we zero in on that, you can see how many of the surrounding areas, you can see how their snowpack is likely to vary and be reduced, again by about 40 to 50% depending on where you are. Precipitation is one of the areas where we don't expect to see changes in the average rainfall to a great extent. This is not something that's going to matter a lot. The truth is, of course, it hasn't affected us. It doesn't affect us much now, right? Our rainfall is fairly minimal. We're in a Mediterranean desert-like climate. And so we shouldn't be surprised that we're not going to see much of a change there. Let's move on. Fire. Now, fire is one of the activities, the natural activities that we live with, and many of us probably have a good sense that fire matters a lot to the air quality. All of us have either lived in communities or driven through communities that are experiencing a wildfire, and the air quality is bad. And in the context of the vulnerable communities in the LA region, the very young, asthmatics, the very old, suffering from respiratory illness, heart disease, other types of things that make people weak, wildfires become really important exposure events for us to keep track of. And this is an area where we can expect to see a doubling of the incidence of wildfires. The small square is 76,000 acres sort of currently burned on average over the last 20 years. You can expect to see that almost double because of the interaction of increased temperatures and winds and things like that. So wildfires are going to become really a very important impact of climate change that we're going to need to manage and accommodate. This is a map that the Luskin Center for Innovation produced. It's a census tract map of LA County, and it shows us the disadvantaged communities, those communities that have very high environmental health risks. And so it helps us begin to think about spatially where the impact's going to be and where are the communities that can least adapt to and mitigate those impacts. And you're going to hear the other presenters today talk about health conditions and effects that are prevalent in these communities, and that we need to think about ways in which to make the communities more robust and more resilient to mitigate those health impacts. And just kind of to summarize the impact part of this for LA, with increases in temperature, that's the direct impact. We expect to see more heat waves and extreme heat events. That's going to lead to greater urban heat island impacts, so cool roofs will become more important. Trees that help reduce that heat island effect will become more important. We can expect air pollution that is caused by or facilitated by higher temperatures like ozone and VOCs to become higher. These changes in seasonal events and extreme heat days are going to lead to greater risks of wildfires, and there will be many communities in which the number of days that kids can play outside recreationally will be reduced, and that'll have impacts on obesity and things like that. So, and we're in the position now of being able to anticipate where these communities are and plan ahead. So that's the opportunity that we face. Just moving down, changes in flooding and heavy storm patterns. That can affect things like mosquito and other vectors, and it will also affect our ability to enjoy high water quality and fresh water quality in many of our local water bodies. And then lastly, flooding and coastal erosion. Again, these are things that, because our economy in part depends on beach tourism and tourism to Southern California, we want to think about and manage effectively. So a summary of the impacts that would go in that first circle.